Here, I guess. Okay, hi everybody. Welcome to today's webinar. Uh, what I was thinking we should do is, since this is test your medical knowledge, everybody could get out a piece of paper and a pen, and it'll be like multiple choice. You know, you pick A or B or whatever. Oh, just a second here. Okay. All right. So yeah, everybody get out a piece of paper and a pen if you want to test your knowledge. And my name is Lisa. Welcome everybody to today's webinar. So we'll get started. So the first question is, persisting over a long period of time, is it A, acute, or B, chronic? So just write down on your piece of paper, question 1, put A or B, whichever one you think. We'll go to the next slide. So the answer is B, chronic. Acute means an illness that is short in duration, but it can be very severe. Where chronic, it goes over a long period of time. So the next question. It's question 2, word meaning present at birth. Is it A, congenital, or B, acquired? For those of you that arrived, I just mentioned to everybody to take out a piece of paper, and that way you can test yourself. So we're on question 2 right now. And the question is, just a second. Okay, so like I was saying, you can get out a piece of paper and a pen and to test your medical knowledge. So right now we're on question 2, and the question is word meaning present at birth. Either pick A, congenital, or B, acquired. Okay, so the answer would be A, congenital. Acquired is a disease that a patient is not born with. Okay, it's just something that happens over time. So your next question is question 3, muscles located on the back of the upper arm. Is it A, biceps, or B, triceps? Muscles located on the back of the upper arm. That would be B, triceps. Biceps are major muscles in the front of the upper arm. Okay. Question 4 is any disease of the muscles. A, myopathy, or B, myalgia. Any disease of the muscles. The answer would be A, myopathy. Myalgia means muscle pain. So remember the algia, that always means pain. So just remember your prefix. Okay. Question 5, pertaining to the groin area. Would that be sublingual or inguinal? Oh, second. we're doing right now is taking out a paper and pen and writing down the answer, the choice that you think is correct. So question 5, we're on question 5, and that's pertaining to the groin area. A, sublingual, or B, inguinal. Everybody should have answered by now. That would be B, inguinal. Sublingual is the area under the tongue. Okay? So, wonder if everybody's doing good so far, hopefully. Okay, so question 6. Name of the lower jawbone. Is it A, mandible, or B, maxilla? Name of the lower jawbone. That would be A, mandible. Maxilla is the top jawbone. How's everybody doing? Everybody get that right? Okay, question 7. The bones of the wrist are called A, carpals, or B, tarsals. The bones of the wrist. Carpals or tarsals. The answer is carpals. Tarsals are the bones in the ankle and heel. So the best way to remember that is just remember when you think about carpal tunnel. That's the nerve that's getting pinched up in your wrist. And tarsals is in your ankle and heel. So, okay, question 8. Which medical word means part of the hip bone? Is it A, ilium, I-L-I-U-M, or B, ilium, I-L-E-U-M? Which medical word means part of the hip bone? For those of you that arrived a little late, you can take out a paper and pen and just write down, question 8, and then you can just put A or B beside it to test your knowledge to see how good your medical knowledge is. So the answer to that is A, ilium, I-L-I-U-M. The ilium, I-L-E-U-M, is part of the small intestine. So, and a lot of times too, when you have sound-alike words like that, check out your book of style, Appendix C. In your book of style has a lot of sound-alike words. And just like rails, R-A-I-L-S versus rails, R-A-L-E-S. And it says, so far, so good, but I'm already at career development B. I have a mixture of different questions, so it really doesn't matter where you're at in the course, so it's all good. Question 9. What is the dictator meaning when he or she says vitals per EMR? Vitals per EMR, per EMR. Is it vitals? A, vitals were taken in the emergency room, or B, vitals are found in the electronic medical record? So vitals per EMR. What does that mean? Vitals were taken in the emergency room, or vitals are found in the electronic medical record? Okay. The answer is B. Vitals are found in the electronic medical record. EMR doesn't stand for emergency. Okay. That's right, Jane. You can remember ilium with the I as in hip. That's correct. Okay, question 10. What does the prefix Brady mean? A, slow, or B, fast? The prefix Brady mean A, slow, or B, fast? The answer is slow. A, slow. The prefix tacky would mean fast. Brady is slow and tacky is fast. Question 11. What does the suffix Malaysia mean? Is it A, hardening, or B, softening? Malaysia. The suffix Malaysia mean hardening or B, softening? The answer is B, softening. The suffix sclerosis means hardening, but Malaysia means softening. Question 12. What does the prefix hypo mean? Is it A, above normal or excessive, or B, below normal? Hypo. What does the prefix hypo mean? Above normal or below normal? Okay, let's see. So the answer to that hypo is B, below normal. The prefix hyper would mean above normal or excessive. And just to give a quick mention, remember, whenever you come across a report that has hypo or hyper in a word, really listen to it carefully, okay, to make sure that you have the correct prefix, because that can have a real critical impact on patient care, because that you're talking total opposite ends of the spectrum. So that would mean, totally different type of treatment for a patient. So bear that in mind whenever you come across hyper or hypo in a word. Question 13. Medical word for difficulty swallowing. Is it A, dysphagia, as in D-Y-S-P-H-A-S-I-A, or B, dysphagia, D-Y-S-P-H-A-G-I-A? Medical word for difficulty in swallowing. And again, I'd like to mention, when it comes to these kind of sound-alike words, Appendix C in your book of style on sound-alikes, you'll find that stuff in there, if you're wondering. Okay, so dysphagia, D-Y-S-P-H-A-G-I-A is the correct answer. Dysphagia, D-Y-S-P-H-A-S-I-A, means difficulty with speech. So you really have to kind of check out sometimes the context of the sentence to figure out which word the dictator is wanting to know. So, for example, if they say, they're saying a bunch of stuff, and then they say dysphagia as far as the D-Y-S-P-H-A-G-I-A, and it goes on to say, a buildup of, a buildup of fluids in his throat, or a buildup of fluids in general, then it would be the D-Y-S-P-H-A-G-I-A, the difficulty in swallowing. See, difficulty in swallowing. So sometimes you have to kind of read the whole context of that sentence to try and figure out which one the doctor is talking about. Question 14. Gland that is located at the top of the kidneys. Is it A, pituitary gland, or B, adrenal gland? Gland that is located at the top of the kidneys. The answer is B, adrenal. The pituitary gland is a pea-sized structure located at the base of the brain, just below the hypothalamus, where the adrenal is located right on top of the kidney. Okay, so remember the pituitary gland is actually at the base of the brain. Question 15. The anterior lobe of the pituitary gland is also known as A, neurohypophysis or adenohypophysis. I'm giving myself some tongue twisters here to pronounce. I would want to say that 5 times fast. So the anterior lobe of the pituitary gland is also known as neurohypophysis or adenohypophysis. And see, this kind of thing is where, unless you're a medical whiz that knows everything, this is the kind of thing, you'd have to research to find out what this all means. It's actually adenohypophysis. Neurohypophysis is known as the posterior lobe of the pituitary gland. Question 16. The hormone aldosterone, I always had trouble with that word, that is secreted by the adrenal glands regulates what? Is it A, the quantities of sugars, fats, and proteins in cells? Or is it B, the amount of salts in the body and the body fluid volume? See, a lot of times this kind of information is good. So that way there, if you have a general idea of the glands and stuff like that, when they get talking about hormones, they may give the patient a shot of hormone, some type of hormone. If you're not sure of what hormone, well, if you knew the gland that they're trying to regulate, then that would certainly narrow things down for you to figure it out. So the question is, or the answer, sorry, is the amount of salts in the body and the body fluid volume. Cortisol actually is what regulates the quantities of sugars, fats, and proteins in cells. Okay, everybody get that? Okay, question 17. What does myopia mean? Is it A, nearsightedness, or B, farsightedness? Myopia. What does myopia mean? Nearsightedness or farsightedness? It's A, nearsightedness. Hyperopia means farsightedness. Question 18. What is another name for lazy eye? Is it amblyopia or estropia? Another name for lazy eye. It's A. The answer is A, amblyopia. Esoptropia means one eye turns inward. So esotropia means one eye turns inward, and amblyopia is another name for lazy eye. Okay? Question 19. What is, boys, I'm picking some wild words. What is plebharptosis? Oh my. I murdered that word. Sorry, everybody. What is plebharptosis? Plebharptosis. Drooping of the upper eyelid or benign growth of the conjunctiva. That's how that's pronounced. Conjunctiva of the eye. So is it drooping of the upper eyelid or benign growth of the conjunctiva of the eye? What is plebharptosis? Everybody try pronouncing that to yourself. What is plebharptosis? It's a tongue twister at first until you kind of say it a couple of times, and then it'll finally roll off your tongue. So is it drooping of the eyelid or benign growth of the conjunctiva of the eye? Let's see. The answer is drooping of the upper eyelid. Petechia is a benign growth of the conjunctiva of the eye. So, question 20. What word part means the color black? Is it A, melan or melano, or B, ERYTH or ERYTHRO? Eryth or erythro. Word part that means color black. The answer is A, melan or melano. ERYTH or ERYTHRO means red. Color red. Okay. Question 21. What part means the color purple? Is it POLIO or PORPHYRA? What word part means color purple? It would be PORPHYRA. POLIO, polio, means the color gray. Question 22. Which medical word is the name of a skin condition? Is it A, eczema, or B, emphysema? Which medical word is the name of a skin condition? A, eczema, or B, emphysema? The answer would be eczema. Emphysema is a disease of the lungs. For that one. Question 23. What is oral candidiasis also known as? A, herpes simplex, or B, thrush? What is oral candidiasis also known as? Herpes simplex or B, thrush? The answer is B, thrush. A cold sore or fever blister is also known as herpes simplex. A lot of times thrush babies Little babies get that a lot. Question 24. Which one is the plural form? Diagnosis, as in D-I-A-G-N-O-S-I-S, or B, diagnoses, D-I-A-G-O, or G-N-O-S-E-S, the plural form. Which one is the plural form? The answer is diagnoses, D-I-A-G-N-O-S-E-S. Diagnosis, S-I-S, is singular. It's easy to get those two mixed up. But just remember, S-E-S is the plural form, and S-I-S is singular. Question 25. What is the name of the relaxation phase of the heart? Is it A, dystole, or B, systole? The name of the relaxation phase of the heart. A, dystole, or B, systole? The answer is A, dystole. Systole is the contraction phase of the heart. Let's see, question 26. What is the name of the top chambers of the heart? Is it A, ventricle, or B, atrium? The top chambers of the heart. So, question 26. What is the name of the top chambers of the heart? A, ventricle, B, atrium. The answer is B, atrium. Ventricle is the bottom chambers of the heart. So you have the top left atrium and top right atrium, and then your bottom left ventricle and the bottom right ventricle. Okay, so the next question is question 27. What is the name of the only artery that carries deoxygenated blood? A, pulmonary artery, or B, aortic artery? The name of the only artery that carries deoxygenated blood. A, pulmonary artery, or B, aortic artery? Answer would be A, pulmonary artery. Aortic artery carries oxygenated blood. So remember that. That's the only artery in the human body that carries deoxygenated blood is the pulmonary artery. Question 28. What is the name of the valve that separates the left atrium and left ventricle? Is it A, is it A, mitral valve, or B, tricuspid valve? The name of the valve that separates the left atrium and left ventricle. A, mitral valve, or B, tricuspid valve? The answer would be A, mitral valve. The tricuspid valve separates the right atrium and the right ventricle. Okay, question 29. Another name for a heart attack is A, myocardial faction, or B, myocardial infarction? Another name for a heart attack. Myocardial faction or myocardial infarction? The answer is myocardial infarction. No such thing as a myocardial infarction. So I got you. If anybody picked the other. So remember that, myocardial infarction. Because a lot of students too put myocardial infection or injection, everything but, or infracture or whatever, but it's myocardial infarction. I-N-F-A-R-C-T-I-O-N. Question 30. What is a noticeably rapid, strong, or irregular heartbeat due to agitation, exertion, or illness? Is it A, palpation, or B, palpitation? What is a noticeably rapid, strong, or irregular heartbeat due to agitation, exertion, or illness? A, palpation, or B, palpitation? And a lot of times people are getting those two mixed up as well. The answer is B, palpitation. Palpation is the process of using one's hands to examine the body, especially while preserving/diagnosing a disease or illness. That's like when the doctor sometimes will tap on your back or chest or whatever while usually on the back while they're listening to your chest and stuff like that. That's what palpation is. And palpitations is, your heart's fluttering and that sort of thing. That's right, Sandy. It's B. Question 31. What does GERD stand for? Gastroesophageal reflux disease or B, gastroesophageal reflux disease? Anna, is that how you came up with these based on frequent errors? Some tough ones. A lot of them, Anna, yes. Were errors, student errors. And other ones I put in there just to see, for you to test your medical knowledge. Time to find where to join the conversation. Okay, so the answer is gastroesophageal reflux disease. The word reflex means performed without conscious thought as an automatic response to a stimulus. Like when the doctor hits you below the knee there to test your reflexes. Question 32. What does hematemesis mean? A, vomiting blood, or B, coughing up blood? Hematemesis. What does hematemesis mean? Vomiting blood or coughing up blood? The answer is A, vomiting blood. Hemoptysis is the coughing up of blood. So, that's right, Sandy. Question 33. What tube connects the bladder to the outside of the body? Is it A, urethra, or B, ureter? What tube connects the bladder to the outside of the body? A, urethra, or B, ureter? The answer is A, urethra. The ureter connects the kidney to the bladder. Question 34. What is the medical word for involuntary bedwetting? Is it A, enuresis, A-N-U-R-E-S-I-S, or B, enuresis, E-N-U-R-E-S-I-S? And again, you would find stuff like that in Sound Alikes Appendix C in the Book of Style. The answer is B. That's right, enuresis. Anuresis. Anuresis, Anuresis, is retention of urine in the bladder. You can't get rid of the urine from the bladder. Question 35. Name for liver disease. Is it A, cirrhosis, or B, cirrhosis? So you have one A spelled as Cirrhosis, or B, Xerosis. Name for liver disease. Correct answer is A, cirrhosis, Cirrhosis. Cirrhosis, Xerosis, is abnormal dryness as seen in the eyes, skin, or mouth. So a lot of times, again, like I said, when you have these sound-alike words and you're not sure, you have to read the rest of the context of that sentence, so you'll know, and then plus look up the meaning of each sound-alike word to know what it means, and that certainly will help you as well. Sandy, are we supposed to be answering you? It doesn't matter. You can put an answer there, or you don't have to. Makes no difference. And we are just noting our answers on our own, no paper, no need to answer there. No, it doesn't matter. You can throw an answer in there, but if you're going to answer in here, just give everybody a minute there to figure out an answer. Okay, question 36. What is the name of a product excreted in urine? Is it A, creatinine, Creatinine, or B, creatinine, Creatine? So see, there's two creatinine, but two different spellings and two different labs. So the answer for that is A, creatinine, Creatinine. Creatinine, Creatine, is high energy phosphate in a blood test. And the creatinine is a product excreted in your urine. So everybody have that in your head? So if they're talking about the urine, it's this. Creatine. If it's a blood test, then it's the Creatine. Question 37. Which word pertains to the bladder? Is it A, vesicle, Vesicle, or B, vesicle, Vesical? Which word pertains to the bladder? The answer is B, vesicle, Vesical. Vesicle, as in Vesicle, is a small sac containing fluid, as in the lesion seen in chickenpox, for example. So how's everybody doing so far? Do you know more medical knowledge than what you thought, or less than what you thought? Great. That's good, Amanda. Very good. Okay, question 38. Pertaining to a lip or lip-like structure, is it A? Oh, Ellen, great. More than I gave myself credit for. Me too. Caught me a couple times so far. That's great. So pertaining to a lip or lip-like structure is A, labial, as in Labial, or B, labile, Labile, pertaining to a lip or lip-like structure. I just like to do this because I just thought it'd be kind of fun for you to, just to test your medical knowledge, just to see, what you may have learned along the way that stuck with you or whatever. It's something you can interact with instead of listening to me just drone on about whatever. So I hope you are all enjoying it. So pertaining to a lip or lip-like structure is A, labial, Labial. The labial that's spelled Labile means unstable, as in labile blood pressure. So those are the difference. Team, yes, this is fun. Thanks. Oh, you're welcome. I'm glad you're enjoying it. So, question 39. Medical word for painful menstruation. Dysmenorrhea. Is it A, menorrhagia, or B, menorrhagia? So medical word for painful menstruation. Dysmenorrhea. Is it A, menorrhagia, or B, menorrhagia? Okay, it's B, menorrhagia. Menorrhagia is excessive uterine bleeding. So you just have to remember your suffixes. All right. So let's see. Oh, I just blew that one. Sorry, people. Question 40. Chronic thickening and hardening of the skin is known as A, scleroderma, or B, scleroderma. Notice the spelling. Scleredema or Scleroderma. Chronic thickening and hardening of the skin is known as B, scleroderma, Scleroderma. Scleroderma is unusual swelling of the facial area. Remember, derma, that means skin, right? And of course, edema, that means swelling. So a lot of times you can kind of figure out words when you look at, the suffixes or prefixes as well. And you can kind of put the two together and figure it out a lot of the times. And that's it, folks. Mistakes. So remember, mistakes are proof that you are trying. So it's okay to not know. It's not okay to not try. That's the difference. I mean, to learn, you're going to make mistakes along the way. That's part of the learning process. And if you weren't making any mistakes, then, you wouldn't need to take a course if you knew everything, right? So just remember that. Don't get all frustrated or down because you make some mistakes. The biggest thing, as long as you're learning by them, that's the thing. Make note of all your feedback on the errors that you're making throughout the course, just so you don't keep repeating the same errors. So, thank you so much for this, Lisa. Oh, you're welcome, ladies. I'm glad you enjoyed it. Like Ellen, didn't realize how much I knew. Really good exercise. Thank you so much for this. Thank you. I was late. Will this be on the forum? Yes, Stacy. Jackie will put it on the forum there in the next day or two or so. You're welcome, ladies. I'm happy that you enjoyed it. Oh, that's great, Ellen. Thank you. This one is called, let me get up to the test your medical knowledge. Have a great day, everyone. Thank you. I knew more than I thought. That's great. And it's always nice to know that, you're like, wow, I didn't realize I knew that much. And that's one of the reasons why I wanted to do this, because a lot of times a person, you start feeling lost out there and you think, oh, am I really even learning anything? Or, you know, that sort of thing. And then you do something like this and it's like, wow, I guess I'm impressed with myself. I know more than I thought. That's great. Okay, well, I hope you all have a great rest of the day, and we'll probably be seeing or talking to you again sometime. Bye, Ellen, and the rest. You're welcome. Bye-bye.